Hello folks, I'm Dr. Fazil. You're watching September 2024 edition of Dr. Fazil TV show. Today's the topic of discussion is urinary tract infection. I'm also a kidney specialist as well as internal medical specialist. In both of my practices, I see a lot of patients in my daily clinical practice suffering from this condition. So it was important for me to talk to you guys about this important clinical condition, which is very common in the community, and then also sometimes it is not treated early, or it can got complications. So it's important to recognize the earlier symptoms of urinary tract infection and then seek medical attention. We can also talk about some myths in the management of UTI. Like use of cranberry juice and stuff like that, and apple cider vinegar. So folks, I'm also going to be using some holograms in throughout my discussion while I'm discussing this topic, so we can so I can better explain this topic for better understanding. I'm going to use a slideshow in my back also to help it make it easier for you guys to understand it better. So let's start with the first thing first. So I'm going to bring a hologram. Let's bring it from here this time, and you can see this is a hologram of an anatomy of a urinary tract. Now remember, we're going to talk anatomy of male and female also, so we can understand what's the difference, right? So this is a hologram of a male, and you can see there's the kidneys, the ureter, which are the tubes which connect the kidneys, which make urine, and then it comes to this urinary bladder, and it stays there until the person passes the urine. Right underneath the bladder, there's a prostate, and then the urethra, which make the urine go away. So folks, remember, the urinary tract infection or urinary tract by itself includes everything. That includes the kidneys, the ureters, the tubes which connects the kidneys with the urinary bladder, prostate, and urethra. They're all part of the urinary tract. So urinary tract is not just infection in the bladder, it could be the kidneys as well. So we typically divide them into upper urinary tract infection and lower urinary tract infection. The lower urinary tract includes up to the urinary bladder. When it goes higher than the urinary bladder, we call it upper urinary tract or upper urinary tract infection. And the difference is that upper urinary tract infection has a lot more serious side effects, complications, because it can spread the infection to the bloodstream and cause something known as sepsis. So we have to be vigilant about that, and if that's happening, then we should be more aggressive in management. So folks, let's bring a female hologram. So I'm going to let this hologram go away. Let's bring another hologram, and you can see this is a female hologram. We'll spin a little bit, spin, and then you can see from the front and the back side. Let's hold it right here. We're holding it. So in this way, you can see that the upper tract is the same. You know, you have the kidneys, you have the ureters, urinary bladder, and urethra, and there's no prostate. So female do not have prostate, right? That's a basic difference. So folks, also the urethra is more closer in females to the anal cavity, so they are easier to get infection because of the proximity. The urethra proximity to the anal cavity, the fecal material can easily can be transported easily into the urinary bladder. So the female typically get more UTIs and men get less, right? Also, people who have diabetes, mellitus, they have more serious UTIs than the people who don't. So that's why the guidelines are different. So the people who have the people who are diabetics, they should be treated for a long period of time with antibiotics versus people who don't have diabetes mellitus. So that's the difference. Men typically need to be treated for longer duration with antibiotics than females. Well, let's say for females that the treatment is antibiotic for 3 to 5 days. If they don't have diabetes, 7 or plus days if they're diabetic. Men 7 days if they're not diabetic, and 14 days if they're diabetic. Again, this is based on their uncomplicated UTI. Uncomplicated UTI means that they don't have infection like due to kidney stones, blockage of the bladder due to prostate enlargement or prostate infection. If you have a prostate infection, we call it prostatitis. It could cause prolonged symptoms, and that typically the treatment is up to a month and a half. So, folks, yes, it's important to recognize the symptoms of UTI and then seek appropriate treatment to avoid long-term complications, right? So let's have this hologram go away. Now you can, let's talk about the symptoms. The symptoms of UTIs are like burning in the urine, frequency of the urine going a lot to the restroom, and then a small amount of the urine, right? Sometimes you can also see blood in the urine, and that's kind of typical symptoms of the lower urinary tract infection.
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
Now, if you have an upper urinary tract infection, if the infection has spread up to above your urinary bladder, then it can cause flank pain in the back. You can see a slide in the back. You can see there's where there's a junction between the lower vertebra, the vertebrae and the rib cage. We call it renal angle, and that's where people have tenderness or pain. So typically, you can see another slideshow behind me, or slide behind me, where the provider is punching a little punch on that area, and there's a pain or tenderness. We call it renal angle tenderness, and that indicates that there might be infection in the kidneys. So. And typically at that time you will have fever as well, and sometimes they don't, depending on your immunity. So that's why in people with older age group, they don't feel symptoms of typical UTI. They don't have that kind of receptors left, or they're more numb to the UTIs. And then what happens is that urinary tract infection can spread to the upper urinary tract portion of the urinary system, and it can spread to the blood and cause sepsis. And it can present with a change in mental status. So anytime somebody in 70s or 80s present with a change in mental status, like confusion, one of the first thing I would always advise or check would be urine for infection, because that is easily treatable but can be easily missed because it can present as, for example, a stroke or another mental disorder, which is not. And the treatment is appropriate antibiotics, and that will fix the problem. So folks, the presentation of typical UTI, of burning, frequency of urination might not be there, and they present state with like confusion, and at that time they are not able to give a good history. So it's important to recognize that problem, folks. So this is like a common scenarios. Now, uncommon scenarios is like infection in the prostate, right? Prostatitis. Let's bring the hologram again. I'm going to bring this hologram again and bring it up a little bit, and you can see this is the bladder and the prostate, which is a gland below it's a Mens gland. It's below the urinary bladder. It has a capsule, and you can see it's kind of insulated from the bloodstream. But if it does get infection, it is very difficult to treat because the antibiotics would not penetrate into the prostate. So that's why you have a special antibiotic like ciprofloxacin, which has a better penetration into prostate, and that's what you need to use. And for a longer period of time, I said maybe 3 to 6 weeks, or more. And there's a way to confirm the diagnosis of prostate infection, which is beyond the scope of this discussion at this time. But again, it can present with pelvic discomfort, pelvic pain, recurrent urinary tract infection, the infection which is not resolving, or you fix it and it come right back. Then we think about infection in the prostate. Now, it's important to treat that problem because it can lead to a chronic pelvic pain in men, and also in younger men it can cause infertility, right? So it's important to recognize that problem, right? So what is a complicated UTI? The complicated UTI is that the infection is difficult to treat, or it keeps coming back. It generally happens if your bladder is dysfunctional or not able to empty, right? Stagnant urine. So let's bring another hologram here. You can see this is a bladder which is stagnant. You can see the bladder, the urine is sitting. Anytime the urine is sitting for a while because of a enlarged prostate or medication side effect, for example, whatever it might be, or neuropathy, and the bladder is not able to be emptied out, then it can cause infection. So that's another source. Kidney stones, if you have a plugged kidney, let's have this hologram go away. There's another hologram. You can see this kidney is right here, is plugged and with the stone, and the urine is sitting inside the kidney. And what happens is that this will cause urine to stay stagnant, and it will cause infection. So we have to be vigilant about that problem, because if people have recurrent UTIs, or infection which will not go away, then we have to look for urinary retention in the bladder or in the kidneys, and then secondary causes like kidney stone. And there's actually another kind of kidney stone known as Staghorn stone. You can see a slide in the back. Staghorn stone is a stone which is made from recurrent urinary tract infection. Now, folks, you remember that the recurrent UTIs is not just inconvenient, but if they happen in the kidneys a lot, they can destroy the kidney as well, and it can actually cause so much malfunction that you can end up on dialysis, like kidney replacement treatment, like hemodialysis. So Staghorn stone is very difficult to treat. Once you get it, the treatment is generally you just take the kidney out. So it's caused by a certain kind of bacteria. So we have to be vigilant about that as well, right? So now there are certain conditions which will cause that kind of stone. Again, this is not a common problem, but again, this is out of the scope for discussion today. We'll do know that there's some metabolic conditions like hyperparathyroidism. There's a parathyroid gland in the neck which can cause more hormone secretion and can cause kidney stones due to high calcium level in the blood. So there are conditions which can predispose you to more infection. So when you have a numerous infection, the provider should look for all that. So the investigation goes a little bit further out, and then start to look into secondary causes of recurrent infection. And obviously, the most common cause is too much use of antibiotics. It can cause resistance in the bacteria in the urine, and then nothing will work. So then that's another source of difficult to treat infection. So sometimes we don't treat infection if it is symbiotic relationship. So for example, somebody have a indwelling Foley's catheter. You can see a picture in the back. There's a catheter inside the bladder, and there's once you have a foreign body in the bladder, you will have infection. You will have bacteria. So not every time you need to treat it. So we only treat in those situations when people have symptoms, like burning, fever, and stuff like that. And if it is just positive urine on the dipstick, then no symptoms, we'll leave it alone because it is just a symbiotic relationship between bacteria and the urinary bladder. And if we keep treating it over and over just to cure the urine, but not the patient, then when the real infection happens, then nothing will work. The antibiotics will have resistance, and we will have a problem to fix infection. So we generally don't treat that. So this is how the UTI is urinary tract infection. You can see how it can change and cause damage. What are the symptoms? How the provider should do the workup, and what are the ramifications if we don't treat it? And when should we treat it, and when should we don't treat it, right? There's some myths we need to talk about it, like use of, for example, cranberry juice. Remember, cranberry juice has some chemicals which protects the infection, but once you have infection, it will not do any good to you. So if people have a lot of recurrent UTIs, they can, in between the UTIs, they can take cranberry juice on the regular basis. It will definitely protect or lower the recurrence of UTIs, but if you have active UTI, at that time, it will not help you. Let's talk about the recurrent urinary tract infection, generally the female, right? So general hygienic conditions like wipe from front to back. If somebody have diapers, then change them frequently. So there's no source of infection going into the urinary bladder. That will help bring a lot of fluids. Also, more than 3 infections in the year qualify you to have a antibiotic like nitrofurantoin or Bactrim to take on a regular basis at night to prevent infection, right? But that's up to the providers who qualify for that and who don't. But if you have more than 3 infections in a year and without any reason, and you can't find the source, then the guideline is to start on a prophylactic antibiotics like nitrofurantoin, you can see on the back, or Bactrim. Those are the common medications. The dose is different for each antibiotics, but pretty much Bactrim is used 3 times a week, and macrodentin or nitrofurantoin is used once a day, at night. So again, there's other scenarios too, like do you have infection, urinary tract infection after the sexual activity or without sexual activity, like intercourse. So if you do have an infection mostly after the intercourse, then the guideline is to take antibiotic right after the intercourse, so it doesn't come back again. So those are a few other special scenarios where the treatment is a little different. But folks, this was all about the UTIs, which you guys need to know at this time. I think it will make you more vigilant about when to seek treatment. And then I hope that was useful. On that note, I will be back next month with another useful topic. And again, I'm Dr. Fazil. You've watched Dr. Fazil TV show about urinary tract infection and related problems. Thank you. Have a nice day. God bless you. God bless America. Bye-bye.